Dr. John with NBC News on his Facebook Live, giving you some headlines for the last couple of days and getting behind those headlines to give you a better understanding of what that means and particularly what it means for you and your loved ones. On top of that, I also answer questions. So please, if you have any questions, send them our way. They're always fantastic questions, and we'll get to as many of those as we can. We try to make this as informative as possible. First, let me start with the headlines that I want to cover this time. Number one, a study was recently done looking at masks and finding out which masks work better for us. And here's what they found out. It might surprise you a little bit. I don't think this will surprise anybody. But first off, the way they did it was pretty interesting. Using very cheap technology, they used lasers and just simple laser pens, cameras on phones, and little booths. And what they found is looking at different masks, that different masks work differently at keeping us protected from coronavirus. One that protects you the most, obviously the N95 mask. They found out that this gives you the most protection. The issue with the N95 masks, if you've ever worn one, you know they can be hot and uncomfortable. On top of that, they have to be fitted. And that's what we do in the hospitals. We often get them, every year we get fitted with an N95 mask in case we need to use them. Well, now, obviously, for the past few months, we've had to use them. But that fitting requires certain technology in order to make sure it's fitted properly and that you're getting the proper benefit from it. So N95 masks work the best. And here's the nice thing about the study. What they did, as opposed to some other studies, which looked a lot at coughing or sneezing or those things that can spread the virus very far, this one looked at somebody just basically talking. They said a sentence and they try to find out where the respiratory droplets might have gone through. Well, then they found out that the ones that worked as well, almost as well as N95s, not quite, but almost as well, were a couple of ones, and this probably won't surprise you, surgical masks. They filtered out, especially the 3-layer surgical masks we call these, they filtered out almost as much as the N95 mask. So when the person had it on and they're talking and they're examining what kind of respiratory droplets come out, not that many were coming out. On top of that, multi-layered cotton masks that people make at home, these home masks, these worked as well as the surgical masks. And so that's good news because oftentimes these are hard to get, and early on these were hard to get. Cotton masks that you make at home, you can make them very entertaining. These things work very, very well. And so the one thing they did find out, though, is the bandanas that people use. The bandanas are too thin. They don't really cut out that many respiratory droplets that come out. On top of that, at least in this study, what they found out, it might actually make things worse because what they were doing is they were actually breaking down those respiratory droplets into smaller particles, and those smaller particles were able to linger in the air longer. And so what they're saying is it's theoretical that the bandanas might cause more issues than they help with. But aside from the bandanas, obviously, N95s work the best. Surgical masks and these homemade cotton masks worked almost as well, and they're much more convenient and much easier for us to use. The other study that kind of joins with this one is a study that came out of Ball University or Ball State in Indiana. And what they found out is people are actually altruistic. If you tell people that wearing a mask protects other people around them, doesn't necessarily protect them, but protects other people around them, they're more likely to wear the mask. And so if you have a friend that's not wearing a mask, if you're around people that aren't wearing masks, instead of just saying, hey, cover up, wear a mask, say, you know, if you wear a mask, you're protecting the rest of us and your community. You need to help out. Then people, according to the study out of Ball State, were more likely to wear masks. And so food for thought. So that's masks. Switching topics here, the other headline that came out recently are children that have gotten sick over the last few months. Now, all along we've talked about children not getting as sick as adults and not necessarily having as many complications or issues from coronavirus as adults. That has turned in some instances to people saying that children don't have effects of coronavirus, don't get sick with coronavirus, and don't spread coronavirus. And what I frequently say is, children can get coronavirus, they can get sick from coronavirus, and they can spread coronavirus, but they don't do it as often as adults. And that's what we're finding out. But one thing we have found out is children getting coronavirus, the numbers have accelerated over the past few months. And this new study that came out of American Academy of Pediatrics and out of the Children's Hospital Association found out that since the beginning of coronavirus, of the pandemic, 338,000 children have tested positive for coronavirus. The last 2 weeks of July, 97,000 tested positive. So you can see that's ramping up. Now, part of that is the testing, because more testing is being done on asymptomatic children without symptoms than before. It was reserved for sick children. So we're getting more of those numbers, but we're also seeing more cases of actual cases, more hospitalizations. But the good news is they also found out that those hospitalizations, even though the number's going up, they're not as nearly as much as adults. Deaths, not nearly as much as adults, but we do get concerned about the spread, especially now that school is reopening, and making sure that schools are doing the proper things to reopen to keep the kids, the staff, the teachers, and all their associated families safe during this time of reopening. And one of the big things I frequently talk about is school systems, parents, staff, teachers, everybody needs to be very flexible and very creative. So you might see that schools open up a little bit and then pull back on that opening a little bit, depending on how cases are going, not just in the school, but in the ongoing community too. And it might be that one part of the school system has to close down for a little bit because there's cases in that part of town versus another part of the school system. Again, it's going to be different across the spectrum. It's going to be different across the country. And it's going to be different for different age groups. So we all need to be flexible. We all need to be very creative and very patient. This is something we have not gone through in our lifetime. And so we need to be very, very understanding about what to do and how to do that. And then the third headline I want to talk about are vaccine distributions. Now, we keep hearing news about the vaccine coming out. There was even earlier reports about the vaccine possibly coming out in October. Doesn't look like that's going to happen. Looks like the end of the year, beginning of the year is when we're going to get approval on the final on the vaccine, the initial vaccines, but final approval for them to be used. And then we'll start the distribution. Luckily, all these companies, or a lot of them, are starting to produce right now a vaccine that they hope gets approved. If it gets approved, then they'll start working on a distribution, starting to look at that now and getting fine-tuning of what they need to do. The issue is right now, up until now, this one group called ACIP. It's the Advisory Committee on Immunization Practices. They're the ones that say, okay, if you turn a certain age, you need to get certain vaccines, as in your pneumonia vaccine once you turn 65, different vaccines at different ages. Typically, up until now, they've been the advisory committee to do that, and they've worked with the CDC. Well, now the National Academy of Medicine has been tasked by the NIH to come up with a way to distribute this whole vaccines that are starting to come about. Part of the reason is because up until now, the way it works in our country is it works through commercial entities. And so what will happen is if I'm running a clinic or a hospital, or a public health department, I'll go through these commercial entities that sell medical supplies, and I'll get my vaccines through them as well. And these vaccines are made by manufacturers and sold to these medical supply companies who then sell them to the different entities. The problem is there's essentially some groups that get more of the vaccine, other groups that don't get quite as much as the vaccine distribution. Sometimes that's based on their purchasing power. Sometimes that's based on their population needs. What they're trying to do is make sure that this is not based on purchasing power. This is based on the recommendations for who's getting the vaccine first and who will get it subsequently. And so that part of the equation is taken out, and it has gotten an equitable distribution across the country. And so that's why the NIH is saying, let's work with the National Academy of Medicine and other entities to try and figure this out. But the good news is, we're talking August. They're working on that right now. Hopefully, they think they'll come out with a distribution scheme over the next month or two. You can bet that once they come out with a distribution scheme, there'll be a lot of back and forth as to what works, what doesn't work, a lot of criticism on how to change that, and it'll get fine-tuned as the months go on. There's no perfect distribution system, so once the vaccine does get produced, you're going to see some hiccups there as well. And again, this is the be patient, be flexible part of this whole thing to make sure that we get the vaccine to people who actually need it. So again, going over the three headlines, masks, home cotton masks, those surgical masks, those blue surgical masks you see, according to the study, work well at keeping the virus out, keeping the virus from spreading when people are talking. Bandanas, not so much. They might actually make things worse. And a study found out that if you tell people wearing a mask wearing a mask means you're protecting other people from you, then they're more likely to wear the mask. Sick kids, we're noticing the numbers are going up. We need to be concerned because the school's opening to make sure that those schools are opening safely, and keep an eye on the children because they can get complications from coronavirus, even though they don't get nearly the rate of complications or hospitalizations as adults. And then the vaccine distribution. This is a to be determined what will be happening over the next few months, but we'll hopefully find out more and more information as the weeks go on, and I'll certainly bring that information to you. So now let me see if we have any questions.
How long can I wear a surgical mask before throwing it away?
So the question is, how long can I wear a surgical mask before throwing it away? And taking a bit of a step back, let's look at other masks as well. If you're using cotton masks at home, what we typically say, or I typically say, is if you're out and about and you're just making short trips, you can use that mask for an entire day. At the end of that day, make sure you clean it so that you have a clean mask the next day, or have masks you can substitute out. If, however, you're in a crowded environment, especially an environment in an area that has higher numbers of cases of coronavirus, then you want to switch it out every time you make a trip. So have multiple masks and clean those masks in between so you're wearing fresh masks. Big important step here, big important point. Don't share masks with other people. If I'm wearing a mask, don't give it to somebody else, because that is a direct conduit of me putting virus on the mask, giving it to you, and then you breathing in those viruses. Kids tend to do this occasionally, especially young kids, so be very careful and let them know as well. As far as surgical masks, the same thing. What we typically do in the hospital, if they're visibly dirty, we toss them out. On the other hand, we use them for a day, and then the next day switch out. If you're in an environment where there's a heavy number of COVID-19 cases, if you're in close contact with a lot of people for extended period of times, you might want to think about when you come home, switching out that mask for another one. And those surgical masks, these ones here we're talking about, are very disposable. So just dispose of the masks and grab a new one. But overall, usually you can wear them for a day as long as you're not in a dirty environment or an environment where we know there's high numbers of cases or a very crowded environment.
What about face shields? Do those protect anyone wearing them?
So the question is, what about face shields, and how well do face shields protect people from wearing them? Face shields, we're still getting the studies done on face shields, but what we're finding out right now is they don't protect you nearly as well as masks, and here's the reason. So the masks, number one, again, like I talked about, they protect other people from you. And so when you're breathing out, when you're talking, you get those respiratory droplets out. The mask will block those respiratory droplets from coming out, and they'll protect other people from you from getting any of your virus or much of your virus. On top of that, if you're coughing or sneezing, you can imagine, that cough isn't going to go as far. I tell people it's the equivalent of doing the cough into your elbow, only in this case you're coughing into a mask. But as far as face shields, the issue with face shields is the sides and the bottom are open. And so when you're talking, those viruses can come out, and they can come out through the bottom or the sides, and they can still get to other people. If other people are coughing, the large droplets will certainly get on the face shield, but the smaller droplets can get around the face shields. And so the best defense is to have both the face shields and a mask underneath the face shield. That's the one that can help you the most. If you can't wear a mask for some reason, be it medical reasons, younger kids we get worried about because they tend not to keep masks on as much as they should, or they play with their mask a lot, which means they're touching their face, then face shields sound like a good alternative. Again, we're still looking into the studies to find out exactly what that means, but the face shield, better than nothing, not as good as masks, kind of the overall bottom line.
Should I still carry hand sanitizer with me everywhere, even though I wash my hands?
So the question is, should I still carry hand sanitizer with me, even though I wash my hands? And the answer is yes. You do want to do that, because you might not always be able to get to a point where you do wash your hands. And if you think about it, every place you contact could have coronavirus on it. You could be getting it onto your hands and then onto other surfaces where you could get other people sick if they touch it. Or we touch our face numerous times every hour, don't even know about it. It's a very unconscious move that we do. And you could be touching your face with hands that you haven't been able to sanitize or wash. Now, washing is the best way to go. Soap and water, 20 seconds, really helps get the virus under control. If you can't wash, then hand sanitizer works well. And so carrying it with you for those emergency situations, those situations where you can't get to a sink with soap and water, then hand sanitizers could certainly work. So I recommend carrying it around with you just in case.
I've already had the virus. What do I do now?
So the question is, I already had the virus. What do I do now? So I'll talk about a couple different things. One is as far as the safety measures we know about, and I call them the 3 W's. Wear a mask, watch your distance, 6 feet, and wash your hands. So wear a mask, watch your distance, and wash your hands. You still need to do that. And mainly the reason you need to do that is because we don't know if the antibodies you have are going to protect you long term. We don't know how long you're going to have that protection, and we don't know what level of antibodies you need to have that protection. And so if you've had coronavirus and you've recovered from coronavirus, you still need to do what everybody else is doing. And again, the 3 W's, wash your hands, watch your distance, and wear a mask. So that's part one. Part two is you can help out as well. If you have had coronavirus, then think about donating plasma, because that convalescent plasma, the antibodies in your plasma, could potentially help save somebody else's life who is now struggling with coronavirus. And so think about that. So on one hand, do the same thing everybody else is doing so you can protect your community from coronavirus. On the other hand, go ahead and think about donating plasma, because you could save a life that way as well.
Why in the past months were experts telling us not to wear masks?
So in the past month, this has been very confusing, and this has caused a lot of consternation with a lot of people. If you remember in February, I myself, like a lot of public health officials, said, don't wear masks for a couple reasons. And we never said don't wear masks. We said you don't need to wear masks for a couple reasons. One, at the time, masks didn't seem to work as well as we thought they would. We found out more information since, especially for other coronaviruses, and this coronavirus is acting different than most coronaviruses. On top of that, the masks that were available at the time, the N95s and the surgical masks, we needed to reserve these for frontline workers, people in the hospital, ambulances, policemen, firemen, those that had to be directly in somebody's face who could be spreading coronavirus. They couldn't distance themselves. And so the decision was made at the time by the CDC to say, and by the Surgeon General, to say, hey, we need to reserve these for everybody else. And the concern was if the message had gotten out that, hey, you need to wear a mask, that there would have been a run on these, which there was regardless, but there would have been more of a run on these, and the healthcare workers who needed them would not have been able to use them because they were at a much, much higher risk of people in the general population. Well, then as time went on, over the next couple of weeks or a month, we found out that masks do make a difference. Again, we didn't know that in February as well as we knew that in March and April. And so we started sending out the word, wear masks, especially if you can't social distance. Wear masks if you're outdoors in a crowd. Wear masks, but wear the kind of masks you can make at home. Wear the cotton surgical masks. And as time has gone on, we found out more and more that these kind of masks that you make at home are actually very effective. 2, 3, 4-layer masks, extremely effective. And so you want to make sure that you wear these. And so again, historically looking at it, yes, in February the message had gotten out that masks don't seem to do much good. You don't necessarily need to wear them when you're out and about. But that message changed as we got more information saying that, yes, masks do actually work. And so we've made a switch based on science. And part of it is essentially what I tell people all the time is typically in a given year without a pandemic, you see science come about and get reported in the media after it's been peer reviewed, after it's been studied, after there's been multiple studies looking at it from different angles. And typically what happens behind the scenes is what you're seeing happening right now. Well, they'll come out with information saying, okay, one study shows masks don't seem to work that well. And then another study comes along and says, well, they work better than we thought they did. And a third study comes along and says, that's kind of down the middle of the road. And then a fourth study comes along and says, well, this is a big study, and it looks like masks really work. And so by the time the information gets filtered down and gets out into the media, it's been more or less a settled situation, a piece of information. But what you've seen over the last few months, mainly because this is such a new virus, there's so many people working on it and so much information out there, is you've seen that behind the scenes look at science get placed in front of the scene, get placed out into the open media. And that's now you've seen the back and forth that typically happens with science until we finally get to a certain place and get the information down more solid. You've seen that happen. And so that's why you're hearing these conflicting messages every now and then, including, again, the masks that you heard in February saying, we don't know if they work as well as we'd like them to. Let's save them for frontline workers. To fast forward to August where, hey, these look like they work. People should be wearing them. We should mandate masks because they save lives. And so that's why you're seeing a difference in messaging, not just for masks, but for a lot of things happening. You'll see the same thing happening for viruses. We've seen it happen for hydroxychloroquine, remdesivir, all these different medicines where one study will say it works, and then that's a small study. A bigger study will come along that's a better study and say, it doesn't look like it works. It might actually cause some issues. And then more studies come along verifying that one. And so again, what typically plays out in science behind the scenes is now playing out in public. And so you're getting this conflicting information. And that's why I'm trying to supply you with the information that's as accurate as I possibly can to make sure that hopefully you get a bottom line on all this with the information we know, with the understanding that I understand as well, this information might change over the next 2 or 3 months. Not big changes, but could be small changes, and we'll keep an eye on that.
Can you donate plasma if you take prescription medication?
So the question is, can you donate plasma if you take prescription medication? For the most part, yes. What they'll want you to be is they'll want you to be stable on that medication, which usually means that you really haven't had any changes over the last 3 months. And it depends what the medication is for. If it's blood pressure medicine, if it's heart medicine, they'll want to make sure that it's controlled and that you're donating blood. And when you donate blood, your blood levels go down a little bit, that's not going to cause any issues. But if you have high cholesterol, if you have arthritis, any of those other diseases, should not be an issue with donating blood. So feel free to go. Now, one medical condition, HIV/AIDS, is still a bit of an issue out there. They've changed their programs on who can donate with HIV/AIDS, but for most medical conditions, not a problem at all.
Is the survival rate really 97% for COVID?
So the question is the survival rate really 97% for COVID? And this is exactly what I was talking about a couple of questions ago, of watching the science pushed out into the forefront where these things are going on behind the scenes that are going on behind the scenes are now going on in public. And so you're hearing a lot of conflicting results on what the actual true survival rate is. By the other side of the coin is what's the death rate. Early on, if you remember, the death rate was anywhere from 3% to 4% to 7%. It just depends on how you looked at it. And this comes about because of the way the math worked when it comes looking at death rates and survival rates. And essentially what they do is they take the number of people that have died over the number of people who have coronavirus, and they say that's the death rate. It's usually a percentage. Problem is, we don't really know the number of people that actually have coronavirus because we know that 35 to 50% of people don't have symptoms. And there's no surveillance system in the world that is testing everybody in their population to find out if they have it and testing them on a regular basis. And so they have to make estimates. And those estimates have continually dropped. Right now, most experts think that the death rate is under 1%. And for most part, it looks like it's fairly well under 1%, maybe even 0.5%. So those initial numbers you saw, 3.4% that came out of China, could have been for a couple reasons. Could have been because the virus was so new and so virulent at the time and spread so quickly because we weren't doing the things to keep it under control that that death rate creeped higher. Or it also could be the fact that the testing has gotten more numbers in that denominator underneath the fractions to show us that the death rate is actually lower than we think it is. This still puts it higher than the flu, but lower than some other viruses out there, but it still is a virus that can cause issues and complications. So the overall answer is this is a very winded way of saying we're not exactly sure what the death rate is. That constantly has fallen over the past few months as we get a better understanding of how many cases are actually out there, but not necessarily because the death rate is falling. It's because we're finding out more and more people that have coronavirus and putting that into the equation. Again, the science that is being opened up into the air here and being brought out into the forefront that typically takes place behind the scenes.
Is there any difference in testing the flu versus COVID-19?
And this is a great question, actually. Is there any difference between testing the flu and testing COVID-19? And this is actually, the overall answer is yes. There are two different viruses requiring two different tests. And typically in a given flu year, you'll even get different flu tests. They're usually on the same card or the same swab. And so what will happen is you'll find out that they have flu type A and flu type B. And they'll look on the flu test. If you do it in a clinic or you do it at the emergency room, you'll do it on a card and you'll see, okay, you're positive for type A, negative for type B, or vice versa. And that tells us what type of flu you have. With coronavirus, with COVID-19, it's going to be one type. You're either positive or negative for it. Those cards are not here yet, but they think they will be. And these are going to be very rapid point-of-care cards, we call them, which take place within usually 5 or 8 minutes in a clinic or an emergency room. They swab you, put it on the card, put a little liquid on there, and it gives you the results. Kind of like the home pregnancy test will, a little line that says positive. The beauty of this is right now, the manufacturers, the companies are making cards that still need FDA approval, but they're making cards that will have multiple indicators on them for flu, for RSV, which is a childhood respiratory illness, for coronavirus. And that way they can do one swab, they can look at it and say, oh, you don't have the flu, you don't have RSV, but you have COVID-19. Or you don't have COVID-19, but you have flu type A. And that way it's one swab, one card. This is going to be a fantastic leap ahead in that technology and much, much more convenient. Now, these cards aren't nearly as accurate as what we call the PCR, which is that swab that they send into the lab and takes days to come back. That's the most accurate test we have right now. These cards are not as accurate, but you're definitely going for quantity over quality, meaning you're getting more people in a shorter period of time, and that can help you keep the virus under control in certain communities and neighborhoods by doing that, even though the accuracy isn't quite as high. Obviously, we'd want 100% accuracy on everything we do. That's not realistic, and so getting these fast and getting these out there cheaply so we can use them multiple times is going to be important to controlling coronavirus. But again, thank you for your questions. They've been fantastic questions. Let me go over our headlines real quick. Masks. Study just looked at the masks. They looked at it with using lasers and cameras, and they found out that N95 obviously work the best, but they're not super comfortable if you've ever worn one. But almost as good, the surgical masks that you see and homemade cotton masks work really well. On the flip side, bandanas actually seem to make things a little bit worse because they made that respiratory droplet into smaller particles that can stay in the air a little bit longer. Children's deaths we talked about and sick kids. We found out that 338,000 kids have been diagnosed with coronavirus since the beginning of the pandemic, 97,000 the last couple of weeks of July. But we're also finding out they don't get complications, hospitalizations, or deaths nearly as much, but they certainly can spread it. So we need to be careful with kids, especially as we're opening school. And vaccine distribution. That's going to be a difficult issue over the next few months, that they're going to come out with guidelines. Those guidelines are going to be critiqued and looked at and fine-tuned. So by the time we come out with a vaccine the end of the year, beginning of next year, we have an understanding of how to distribute it, because this is unprecedented. We've never had to distribute a vaccine nationwide this quickly across the country, and for that matter across the whole world, to try and get everybody vaccinated as quickly as possible with limited doses. Those doses will increase as time goes on, but initially we're talking a few hundred million doses in this country, when in fact we need 350 million doses in this country. So time will tell how this works, and I'll certainly keep you informed. But meanwhile, thank you very much. I hope you have a fantastic week. And for you, your friends, your loved ones, and your families, as always, I hope you stay happy. I hope you stay healthy.